There is something I need to tell you today. Something that could genuinely change the outcome of your health or the health of someone you love. And I say that not to scare you, but because I've seen what happens when this gets missed. When men brush it off, chalk it up to getting older, and don't mention it to their doctor until it's much further down the road than it needed to be. So I want to have an honest, real conversation with you today about prostate cancer, and specifically about one symptom that far too many men overlook, dismiss, or never even connect to their prostate at all. Before I get into that, I want to ask you something, and I genuinely want you to answer this in the comments below. Have you ever had a health symptom that you ignored for weeks, months, or even years before finally getting it checked out? Because I think most of us have. We tell ourselves it's nothing. We tell ourselves we're busy. We tell ourselves we'll get to it. And sometimes, thankfully, it is nothing. But sometimes it isn't. So drop your answer down below. I read every comment. And let's start this conversation together. Now, when most people think about prostate cancer symptoms, they think about urinary problems. Difficulty urinating, a weak stream, feeling like you can't fully empty your bladder. And yes, those are real and important signs. But here's what doesn't get talked about nearly enough. There is one symptom that many men experience, sometimes for months before any urinary issues even begin, and it gets misattributed to something else almost every single time. That symptom is pain or discomfort in the lower back, hips, or pelvis. I know what you might be thinking. Back pain? That's just age. That's just sitting too long at a desk. That's just from the workout last week or the long drive over the weekend. And here's the thing. You might be right. Most back and hip pain has nothing to do with prostate cancer. I want to be clear about that. But the problem is that when prostate cancer spreads, and it most commonly spreads to the bones, particularly the spine, hips, and pelvis, the first sign men notice is often this dull, persistent, unexplained ache in those exact areas. And because it feels so ordinary, so familiar, it gets ignored. What makes this even more complicated is that in its early stages, prostate cancer often produces no symptoms at all. That's the quiet, unsettling truth about this disease. It can grow slowly and silently, and the body doesn't always sound an obvious alarm. So when something like lower back or hip pain does show up, it's easy for both the person experiencing it and even some healthcare providers to dismiss it without thinking about the prostate. But if that pain is persistent, if it doesn't improve the way normal muscle soreness does, if it seems to have no clear injury or mechanical cause behind it, that is the moment to speak up and ask for a proper evaluation. Now, I want to be very clear about something important. I am not telling you that back pain means you have prostate cancer. That would be irresponsible, and it would be flat out wrong. What I am telling you is that unexplained, persistent musculoskeletal pain, especially in the lower back, hips, upper thighs, or pelvis, in men, particularly those over 50 or those with a family history of prostate cancer, deserves attention. It deserves a conversation with your doctor. It deserves a PSA blood test and a proper checkup. Because catching prostate cancer early is one of the most powerful things you can do for your long-term survival and quality of life. Here's some context that I think is worth sitting with for a moment. Prostate cancer is one of the most common cancers in men. In the United States alone, roughly 1 in 8 men will be diagnosed with it in their lifetime. And the survival rate when it's caught early, when it's still localized to the prostate, is nearly 100%. Nearly 100%. But that number changes significantly when it's caught late, after it has spread to other parts of the body. That gap between early detection and late detection can literally be the difference between a manageable, treatable condition and one that is far more serious. So what does that mean for you? It means that awareness is everything. It means that understanding your body, knowing what's normal for you, and paying attention when something feels different is not being dramatic. It's being smart. It's being proactive. And it's exactly the kind of thing I want to encourage you to do. There are other symptoms worth knowing about too. Not because I want you to spiral into anxiety every time something feels off, but because knowledge is power, and your health is worth understanding. Difficulty urinating or a sudden change in your urinary habits. Blood in the urine or semen. Erectile dysfunction that comes on suddenly without another clear explanation. numbness or weakness in the legs or feet. This can sometimes happen when cancer has spread and is pressing on the spine. Unexplained weight loss or fatigue. None of these symptoms in isolation is a guaranteed sign of prostate cancer. But any of them, especially in combination, especially if they're new or persistent, is reason enough to make that appointment. And here is what I really want to leave you with today. I know so many men who put off going to the doctor because they don't want bad news, because somehow not knowing feels safer than knowing. I understand that. I genuinely do. But I want you to reframe that thinking, because not knowing doesn't protect you. It just delays your options. Early detection gives you options. It gives you time. It gives you the ability to choose how you respond, to access treatment before it becomes more complex, and to walk into that doctor's office as someone who is taking charge of their own health rather than waiting for a crisis. If you are a man over 50 or over 40 with a family history of prostate cancer or African American heritage, which carries a statistically higher risk, please talk to your doctor about PSA screening if you haven't already. If you're watching this and you have a husband, a father, a brother, a son, please share this with them. Because sometimes the people we love need to hear something from someone outside their immediate circle before it truly lands. You came here today because something in you wanted to know more. And that instinct, that curiosity, that care for yourself or someone you love, that matters. Follow it. Book the appointment. Ask the question. Get the test. You deserve to take care of yourself, and the people in your life deserve to have you around, healthy and well, for a long time to come.